Let's go to diagnosis according to Zhang Fu organ patterns. This time is spleen Qi not holding blood inside the vessels. Spleen Qi not holding blood inside the vessels is again a variation of spleen Qi deficiency. In this pattern, the spleen is not able to perform its function of keeping blood inside the vessels. This will manifest in bleeding and bruising. The bleeding can take many forms. It may be different kinds of menstrual disorders, such as mid-cycle spotting, heavy menstrual bleeding, or prolonged menstrual bleeding. Or there may be nosebleeds, blood in the urine, or blood in the stools. It is, however, important to remember that spleen Qi not holding blood inside the vessels is just one of several patterns that can result in bleeding. Bleeding can also occur when there is deficiency or excess heat and when there is blood stagnation. There will usually be a combination of more than one pattern at a time. Furthermore, it is important to remember that these patterns will lead to the development of blood deficiency over time. Milder cases of spleen Qi not holding blood inside the vessels are seen in people who have a tendency to bruise easily. The etiology of this pattern is identical to that of spleen Qi deficiency, where symptoms and signs are heavy or prolonged menstrual bleeding, spotting or bleeding in the middle of the menstrual cycle, blood in the urine, blood in the stool, nosebleeds, a tendency to bruise easily, fatigue, loose stools, craving sweet flavors, weakness or fatigue in the limbs, pale complexion, pale tongue, weak or fine pulse, especially in the right guan position. The key symptoms is bleeding, fatigue, pale tongue, and weak pulse. The treatment principle is tonify spleen Qi and astringe the vessels. And the acupuncture points to choose from are stomach 36, spleen 1, spleen 3, spleen 6, spleen 10, kidney 8, ren 12, bladder 17, bladder 20, and bladder 21. With the needling technique of tonifying, and moxa can be used on all points and must be used on spleen 1. The explanation for the points is that stomach 36, spleen 3, spleen 6, ren 12, bladder 20, and bladder 21 tonify spleen Qi. Spleen 10 stops bleeding, spleen 1 with moxa stops bleeding as well, and kidney 8 stops uterine bleeding, and urinary bladder 17 nourishes blood. The advice given in this section on spleen Qi is also relevant here. Spleen Qi not holding blood inside the vessels can be caused by spleen Qi deficiency, spleen yang deficiency, spleen Qi sinking, and kidney yang deficiency. And the result can be blood stagnation, blood deficiency, and yin deficiency. Let's look at the summary of spleen failing to manage the blood. The etiology is excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, the diet lacking in protein, excessive mental activity, prolonged exposure to damp, and chronic illness. The underlying or accompanying pathology is spleen Qi deficiency. The signs and symptoms are poor appetite, slight abdominal distension after food, tiredness, weakness of limbs, pale and sallow complexion, weak and fatigued spirit, loose stools, tendency to obesity, petechiae, blood in urine or stools, excessive uterine bleeding, dizziness, heart palpitations, shortness of breath, and the pulse is weak or fine, and the tongue pale. Treatment principle is to boost Qi to contain blood. Acupuncture treatments are ren 12 that supplements stomach and spleen. The spleen 3 is a source point of the spleen. Bladder 20 supplements spleen Qi, especially in chronic cases. Du 20 raises yang and nourishes the marrow. Bladder 17 nourishes and harmonizes blood. Spleen 1 strengthens the spleen and stops uterine bleeding. Stomach 36 supplements spleen Qi. Spleen 6 supplements spleen Qi as well. And bladder 21 supplements stomach and spleen Qi. Ren 6 regulates Qi, harmonizes blood, and spleen 10 helps spleen manage the blood. Needle with supplementation of moxa. For blood in the stool, you may use Ren 4 and bladder 35. And for flooding or spotting, use Ren 4 and Ren 6. Thank you so much for your attention.